All right, we are recording. You can start.
Okay. All right. So, hi, everybody. Doing it a little bit differently through Zoom Record this time around. My name is Ashley Downing. I am the director of what we call our HIM, which is traditional HIM, and then we have an IMS team, which is like our software applications team. So I oversee both of those teams as well as I'm the privacy officer for North Central Healthcare in Wausau, Wisconsin. Today, I'm just going to talk a little bit about HIM and healthcare IT, really merging that traditional, non-traditional setting and what all involved with living in an IT healthcare world. So really just my story, a little bit of background. I was a CSS grad back in '07, and I really worked in my hometown after that and still do. So I worked at Aspirus for over 12 years in a few different roles. So started in IT, went to HIM, came back to IT. I really loved the two, so I had a really hard time deciding which one. And lo and behold, now I do both. So it really was the perfect merge of that informatics world for me, both on the healthcare IT side and HIM, really bringing information to life. So that really is what set this apart, and joining a smaller organization, having a bigger hat to wear, but really interesting, and I'm loving it so far. So just a little map of where you guys are compared to where I am. So I'm just in the dead center of the state, about a good hour and a half to 2 hours away from anything super, super fun. But our services, we have such an interesting array of services. So I came from Aspirus, which was very much primary care, specialties, kind of the norm. North Central Healthcare really does basically two worlds. So the nursing home side of things, and then the behavioral mental health side of things. We do crisis services. So if people are in crisis and they need triaging, we basically tell them, here's what we need from you. You know, do you have a plan? Do you not have a plan? And then we try and triage from that. So it's essentially like an emergency department, but more so for mental, behavioral, and substance abuse. So we also work with developmental disabilities. So we have an adult day services program. We have service homes and community-based residential facilities. What we also do is we have a skilled nursing home. So we have two of those, one in Wausau, one in Merrill, and we provide a gambit of services. So not only like a ventilator unit, but post-acute care, dementia is something that we're really specialized in. And we also have a aquatic therapy pool. So it's 90 degrees all the time. And if you can just imagine all of those different services we provide, led to a very different world from an HIM standpoint. There's a lot of different laws with substance use disorders, mental behavioral health that are both state and federal. So really interesting there. So really why I went the IT world, it is fast paced. I really like making those decisions. I really love doing the problem solving, critical thinking aspect, you know, diagnosing the problem. What are we actually trying to solve? It's also a corporate department, so it's not just focused and siloed in one area. You get everybody and everyone because IT really touches a corporate entity. Everybody uses technology, whether that be through email and a very simple use to electronic health records and learning about how to really navigate the software. We also really have an endless supply of opportunities on that end. From an application owner analyst area, I'll kind of dive into that as well. But we're really interacting with everybody across the spectrum. So we are looking at it from a system perspective and not just, okay, user Betty would love this functionality. Well, that's great. But how does it impact other people? How does it impact the system? What data are you trying to do? Is it a regulatory? Is it just a nice to have? So we go through all kinds of, people basically get sick of us because we ask a bunch of questions all day long. What we're really looking for as far as healthcare IT skill sets, obviously you have to have that technical component to it. So with CSS and doing the CIS minor, it really helps with that analytical piece. You're really looking at designing. You can definitely go down the code and configuration avenue, but really it's about that analysis and what do people need and the validation, and it can be anything from server administration to a little bit more technical aspects to really interfacing. How do the systems talk to one another? If we have one EHR and the system in pharmacy is different, how do we get those to talk? How do orders come through? How do pharmacists take a look at that and get their orders and verification so that they know that you can deliver and give this medication? Analytics and data is such a huge topic now, past, present, future. And what we are really good at in healthcare IT is understanding the clinical route and the financial route, revenue cycle, and then making that data speak to those so we can really make good decisions on the data, that the wisdom and information that you're getting from that to make good decisions. We also focus really heavily on change management, so making sure that changes and projects are really well thought through. We do what's called ITIL process, so it's basically incidents and requests. You know, how are you filtering people's issues through? A huge part, and everybody kind of thinks, oh, IT, they go sit in the dungeon and don't talk to people. Not true for everything. So there is a lot of verbal, face-to-face, over-the-phone communication where you're trying to, again, diagnose what's happening from a technology perspective. Obviously written, everybody uses email nowadays, so you have to keep it professional. You have to keep it short, succinct, to the point. Nobody wants to read that novel. And then documentation. So if you're doing something in a system, we obviously want to document that so that we know why you did it, how you did it, when you did it, where you did it, so that if something happens, we can always back out of it. From a collaboration standpoint, we're really asking people to have those relationships with our operational partners. And what we mean by operational partners is basically anybody that functions within a hospital care system setting. So those are your end users, is what we call them usually. They're the ones that are using the technology, that are out there on the front lines, whether that be a cashier in the cashier's office taking money and depositing it, or someone on the unit, an inpatient, taking a look at a patient and documenting their vitals. From a productivity standpoint, time management is such a huge piece of our work. We really have to be very thoughtful with how we're spending our time, how we are, you know, making that production or the volume and accuracy of the work. So if someone's having an issue and it's impeding patient care, we can't just say, you know what, I'm a little busy reading my emails, just gonna come back to you in a few minutes. Can't have that. So we really need to focus on prioritizing and understanding how to get through your day. Continuous improvement mindset is huge. You know, working in technology, it's something that is constantly changing. So we're usually better at change than most people, but we like to think it through and make it really make sense. So having that continuous improvement mindset where I literally can't be offended by what you're saying as long as it's for the betterment of a process. So if something didn't work, what didn't work about it and how can we redo it in the future? We also talk a lot about training skills, because not saying you necessarily have to be in front of a huge classroom full of folks, but when you're one-on-one with the end user on the phone and you're trying to help them troubleshoot an issue, sometimes it's not possible to physically go where they are. Example, right now during COVID-19, we're not allowing our staff to go round on the units. Not somebody you need on the units. They're not essential to care. So we're having to figure out, okay, how do we talk to someone? How do we help them go through what the issue they're seeing is, logging onto their computer, talking them through it, but understanding that they don't have all day. So they're usually in a frame of mind where I just want it fixed. So help me fix it. So training is really about how do you connect with that person? How do you de-escalate or calm them down? Because lovingly, whether you work in HIM, IT, or many of the other supporting departments, nobody calls you to tell you they're having a great day and just wanted to let you know. Usually they're calling you for an issue or something that they need. So training skills are really crucial to try and be that liaison and help them understand the technology piece of their operations and how to really make it useful for them. Project management, that is a very huge topic in the IT world and really just something we follow pretty religiously. We try and identify stakeholders and the people that are going to be impacted by the project and what their level of involvement in that project really is. We're creating project plans and making sure that we have task lists and facilitating meetings and really trying to get that product out the door so that it can be in the hands of our end users. So we have really good communication skills, again, going back to communication status reports. How is the project going? How is your work being accomplished? Again, don't need a novel. We need to know the basics. We need to know from a communication standpoint, are you okay in the project? Are you not okay? Do you need some help? What are your barriers? From an attitude perspective, something if you haven't looked into it or haven't heard of it, emotional intelligence is a huge piece of pretty much everybody's world, but especially in healthcare IT, because again, we have to know how to de-escalate situations. We have to know how to read a room when you're facilitating a meeting. If someone's not participating or they're really being not helpful in a meeting, how do you take that and make that social awareness and use that to combat some of those difficult personalities? Volunteerism is huge in healthcare IT. We're here to support the people who do the patient care work, who do the revenue cycle work. Everybody is very important. Supportive departments, ancillary, all of that. We really have that customer service focus. It's our number one goal, no matter what area we're looking into. And then because we do love some structure, love some process, we really want to follow the process. We don't want to just put something into a system that hasn't been tested, hasn't been communicated. I'm sure in some way, shape, or form, everyone has kind of felt that before, and it's just not a good place to be. So we are very much that attention to detail, folks. So kind of what is information management systems? What we're really looking for is that informatics type person, someone who really wants to improve healthcare through technology, information, people, and processes. So AHIMA really lays it out quite nicely. Our job roles are they can be a bunch of different things, but basically it's an analyst in the system. They're understanding how the system works, how the users use the system, and what kind of information goes in it and can be pulled out of it. So some duties or kind of the what do you do in a day? We break it down kind of by, administrative tasks. Everybody has to go to meetings. Everybody has emails. That's how the normal business world communicates. From an IT end user perspective, if we have issues or something worked yesterday and now it doesn't, it's broken, it needs to be updated, we look at that as kind of break, fix, or maintenance, so incident response. We make sure that the systems are up and running and that everybody has the technology they need to do their job. We, of course, have projects, so it can come from a variety of sources, but we have implementations or go lives. So when a project comes from discovery to actual fruition, an implementation is really that go live. How are we preparing? Do we need a command center? How are we training? How are we teaching? How are we educating and communicating? There can be optimizations. So we have the system, we're not looking to replace it, we're not looking to get something new, but we could really use this tweak in the system, or if we looked at this process, we could save a lot of valuable screen time or clicks, as people like to call it. Whatever makes that system easier is usually something we want to take a look at. And then, of course, the lovely regulatory requirements coming from the healthcare world and the IT world. You get hit twice, but knowing what's coming down the pike. So there has been a lot of changes in the last week, even just related to COVID. And if you're reading this next week or listening to it next week, now you've had 2 weeks of it. Also, what I love to touch on, because most people don't quite know that a lot of the analysts do this, is workflow mapping. So what that means is we're understanding and listening to end users and saying, how do you use the technology? We all know how we were trained, and that's great. That how it actually ends up being. So, what are the workflows that you're using? How have you maybe found really good tips and tricks? You might have found shortcuts that we didn't even consider. So, how are you using that technology and how can it be incorporated? And is it a good practice and we should continue it? Or is it something that is actually creating more issues, or it's longer or more cumbersome? How can we make that more efficient? So we lay out the whole map from start to finish and what all happens in between. So we try and get a really good understanding of how people are interacting with the software and technology that we have for them. Kind of just different words to describe analysts. They're your builders in the system. They either do the coding or configuration of parameters or editing the software in some way. We're tweaking it in order to make it better. We have to be great documenters. Our change control processes are lengthy, to say the least. We're also those testers. We don't put anything in that we haven't fully flushed out or tested. That doesn't mean we have 100% error proof rate, because we're human, but it does mean we try and catch those issues before all of the end users would see it, so that we can really anticipate the issues, fix them, resolve them, so that end users never even know that we fixed an issue. We're really that liaison. So a lot of the stuff in the world that we work in is technical and cumbersome, and people just don't understand the technology. And what we do is we try and communicate that intuitive nature of being that liaison and saying, okay, well, what you mean is this in the technology. And we try and communicate that in a language that they understand. So instead of saying, oh, click on this form and go to the flow sheet and do this and do that, what we're really trying to say is, when you admit a patient, this is your process. This is what you screen for. The technology is just a tool to help in the care delivery process. We're also a detective. This is one of my favorite things, is finding those issues and diagnosing the problem and resolving it. So when I was an analyst, I would love to get me some tickets because I loved solving problems. And I'm a bit super competitive, so I liked seeing my numbers up. We're also researchers. So one of the biggest questions that I have my staff and myself ask is this even feasible? Is this functionally, able to work? Is there a product? Is there something that can actually help? Because what I've seen in the past, and I'm sure you'll see in your lifetime too, is someone has an amazing idea and they just think it is the cat's meow, and they just want to go full forward. They have it all laid out. This is what the technology should do. And in the end, they bring you in and it's not even possible to do that. So sometimes we have to say that's not even feasible. Here are some other options. Here's what we can do right now. Or it's not feasible. We can put it into, our request or enhancement queue right now. But for the current day state, this is what we could do. So researching and figuring, we go to Google a lot, what's possible. And then again, coming back to that analytics platform, really being that data analyst. What data is going in the system? What data is coming out of the system? How is it being used? What decisions are people making out of that system? And do they have the right data to make those decisions? This is something that will constantly evolve. No matter what you get into, you'll have an awesome process and then something new will come out. So really just understanding that whole garbage in, garbage out philosophy. If garbage is going into the software and the data is bad, what we're pulling out not going to be any better. It doesn't magically get scrubbed to look beautiful for a report. From a director standpoint, over the HIM and IT folks, we do one-on-ones. So we do mentoring and coaching and really talking about what's going right, what's going wrong, where do you want to be, how can I help you, what are the barriers. So just talking through things like that. I hire the whole recruitment hiring process, onboarding, orientation. I take care of that. So going through applications and resumes and interviews. I've interviewed thousands of people over the years, and I'm not even being overly ridiculous. So we'll talk about that a little bit later, but I'm more than happy to help with that. And really just outreaching. So talking with the colleges, seeing what is new, what they're learning, how we can prepare them to be really successful in the business world, continuous improvement. So I can be on a lot of strategic initiatives and say, this is just not working for our department. How can we make this better? Strategic direction. So where do we want to be and how do we get there? Really mapping out the current state, future state. It's that whole workflow mapping thing. It's just taken to a different level at the director area. Contracts and budgeting, not my favorite. I can definitely do it. I really like the continuous improvement and people portion, but learning more and more about contracts and budgeting because, hey, you need money to run a business. Scheduling and project management and that discovery planning piece. So really understanding what's on people's plates, what's coming down, when you have a strategic plan or really the goals and vision of the company, how do you actually make that work in your day-to-day setting? So really taking this awesome vision and putting actionable tasks to it and saying, if we accomplish this, we will be in line with the vision. And really just taking a look, and one of the most underutilized leadership resources and benefits is that recognition and celebration and appreciation of people. So that is such a huge portion of management. And again, one of the most underutilized things, asking people how they're doing and actually waiting to get a response and listen and interact and really understand where people are coming from. And even if you don't agree or don't necessarily see that same end result that they're trying to get to, coaching and mentoring and understanding that you could be wrong too. So really giving a lot of grace is what a good leader does. One thing that's kind of interesting, whether you do Myers-Briggs or disc profiles or calipers or the standout, your strengths assessment, there's a million different leadership style things. But just an example is for the disc, I have a solid dominance. So I really like to be direct. I like bullet points. I like to get to the point. You will never catch me being indecisive. I'll always tell you where to go and where to be. It's just my nature. That's really how I've been my whole life. I also leak into influence. So I really have learned to kind of be that energizing person because life isn't all about glitter and rainbows. So how are you going to get people to do the work and be motivated and really take a positive approach? Because being a micromanager, negative, person, influences nobody. Nobody wants to live in that environment. So really, how do you empower somebody while giving them kind of guidelines? So that's pretty much, I like to be that cheerleader on the side, but get in there on the football field and get stuff done. From an organization standpoint, so many things with that time management prioritization. This will be a really good thing to take a look at when you start doing your interview process. You know, how do you keep organized? What places are you interviewing for? What have you sent resumes in for? Have you done cover letters? Have you done thank you notes? So really, I use sticky notes both physically and on my computer. There's a sticky notes app, calendar appointments and reminders. Sorry, that got cut off. But just making sure that you have a to-do list, that you're sticking with it. And one of the techniques I really like to use is called Moscow. So it kind of goes through what you must do. So those are obviously your most urgent. What you should do. So, yep, urgent still. I should do this. It's a possibility, not my top priority. Could do, so again, more like the third quadrant, so not that urgent. If it happens, it happens, great. Won't do. You know, this isn't something that really is a valuable use of my time, so I either need to tell that person I can't focus on this right now, or I need to delegate it off. So everyone is so busy and chaotic in the world, you really have to have good boundaries about what you are going to accomplish and how you're going to do that. And this organization and time management is something that can really help you get there. So I really am a Outlook fanatic. So we use Outlook for emails. I love and tricks and efficiencies. So quick actions and rules. I do weekly motivational Monday emails to my employees. I do weekly team updates with a newsletter. So with the newsletter, I'm not going to write the same content over and over again. I put it in a template and I just use that template, put the new newsletter in there, and we're good to go. So it's finding those little things that can make you really efficient, and those are the things that are going to save you time and make you look really credible. And then I am a OneNote fanatic, so when SharePoint comes and Windows deletes that, I don't know what I will do, but we'll figure it out. Just a schedule example from something that I did with a project. You know, it was with a team, so I really wanted to have a start date and end date and really think about how we could do this and what topics we'd need to get through in order to make that possible. So I a week, focused on how long that meeting should be or the duration. I like to keep an hour meeting to 50 minutes and a 30-minute meeting to 25 minutes. So you can allow for bio breaks. You can get to your next meeting, you can get to your next task, and you're not always running back and forth just in a little bit of a chaotic state. And then what phase of the project we were working on, and then when I actually scheduled it, here's the date, the time, the location, and then what agenda topic we were talking about. And as you can see in there, like when we were around Christmas time, you know, we skipped a week for the holidays. Those are really big things to consider, because if you just lay something out, especially with holidays or vacations, or someone on your team has to be out for 2 weeks for a wedding, something like that, you aren't building a schedule that just isn't going to work. So again, taking the time on the front end to really sit down and lay it out and plan for it is going to be really helpful for you at the end. Tips and tricks for you. So, you know, professional organizations are huge. I'm a member of 3 of them. So AHIMA, which is, you know, the National HIM one. There's also a healthcare IT one called HIMSS, HIMSS. There is, since I'm the privacy officer, I also am a member of HCCA, so more on the compliance and privacy side of the world. Those are great resources. You don't have to reinvent the wheel. Someone's probably already thought of something and has something out there. Um, so use those, use the body of knowledge, just be really smart about what you're doing, and you can save a lot of steps. LinkedIn, as a senior, you're ready to go out into the world and get a job. So LinkedIn and making sure you're connecting with your fellow colleagues, with your internships and your mentors there or site people there. Definitely look me up. I have my LinkedIn there, and just connect with people, because you never know who might work at a place you would love to work at, and maybe they have somebody that can help you get in the door or shadow or just have a mini mentor session with somebody. LinkedIn is really a good social networking space that isn't Facebook. TED Talks, those are really good tips and tricks for you. They have great ones on interviewing and how to carry yourself and how to speak professionally and with confidence. The CSS MOOCs, those are great, especially once you're out of school, to just keep continuously learning and keep challenging yourself. Blogs, emails, looking at the Myers-Briggs and other assessments that you can do to really understand what your style is as a person, as a professional, and then as a leader. Those are really important. And getting something like a 360 feedback, what it really means is the people who know you the most, who work with you the most, ask them about, what is my style? How do I come off? What is your perception of me? What can I work on? What, are some things that are really big strengths for me? Because mentorship and all of those questions are really good for self-reflecting and understanding yourself, so that when you're in an interview and they're asking you to give situations and how do you handle things and your strengths and weaknesses, you have stories behind that. That's one of the biggest things I say about interviews, is always tell a story. It doesn't have to be 30 minutes long. Keep them succinct and small, but tell a story. Don't just say, I'm a really good communicator. Awkward silence. How are you a really good communicator? What are some of your styles? How have you done it in the past? How do you work in groups? So just really understanding yourself is going to be the biggest ticket to a really good interview process. Professional development plans. So I've done a ton of research on these. There's a ton of different formats out there, but really the point of doing something like this is to really understand what your future self wants to do. Okay, when I grow up, what do I want to do? What do I want to be? Okay, if I want to be the CEO of a company, that is likely not going to happen on day one. So, what are the steps that I need to get there? It really helps you keep motivated. It really helps you take a look at those goals and break them down and actually achieve them, because the worst thing is, having that goal or vision board or whatever in the world you do, but just never getting to any of that. And what we call that is kind of like a victim of your own busyness. So you are busy doing stuff in the moment, but you're never looking at the future and saying, what do you really want from that? What are you gaining out of doing these 70,000 emails in a day? How can you limit that? How can you really say, okay, from this time to this time, I really want to focus on this. Then I want to take an hour and I want to go listen to TED Talks or do a webinar or read the Journal of a HEMA. I want to do some research. You have to keep that, and you actually have to build that into your schedule, or it's really easy to say, I just don't have the time. I recently read a really good article actually on LinkedIn about, it's not that you don't have time or that you're too busy, it's that you're choosing to do something else. So professional development plans can really help you make those good choices and follow through. Skills to work on, I mean, gosh, there's like a million that you could focus on, but here are some really good ones. My advice is really find a few skills and really hone in on them. So if I were to pick out of this list, I love the facilitation, the process improvement, and coaching. So those are three that I feel like those are kind of my strong suits. Okay, how have you worked on facilitation? How have you learned? How have you grown? Have you shadowed anyone who is a mentor of someone that you really find is a great facilitator? What can you do to improve yourself? So when people ask you, what are your strengths? Then you have something to build on and you have a story and you can say, I've done this and this, and I know I need to work on this. And then again, skills that you need to work on, you can also pick the ones that you're really not that great at. So eh, an easy one is networking. So networking is one that you can always work on. You can always get better at. You can always, pick up that phone or talk to that person at a conference that, yeah, I would just like to really sit here and listen. And I'd like to just go call, my family member on a break. But maybe you take that 10 minutes and you talk with that person and you see their story. And then they're like, oh, I work in the same industry. I'd love to connect. Um, so just find some of those that you also want to work on as well. And usually what people refer to that as is your weaknesses. But just turn it into an optimistic, positive perspective and say, I feel like I have really good strengths in these areas, but I definitely feel like I can still work on them. And here's some ideas and what I've been doing to try and work through those. Resumes. So really, if you're going to do a cover letter, don't just do it super generic. Really tailor each cover letter to the different job. People are going to find you and read right through that. You've used this for a million different ones, and all you did is changed the wording of the title of the job. Really tell your story. If you're going to do it, keep it short, keep it simple. One thing I do check on for applications and resumes is if they just use a ton of buzzwords. So I'm a great communicator, everybody wants to use that. Okay, but how? And if you've um, ran a budget, how large was that budget? What did you have to work with? If you worked on a project, don't just say I did this project. I managed, I facilitated, I coordinated. Um, those are buzzwords, but they're showing that you have a story behind it. It's not just saying I can project manage. Bullets versus sentences. A lot of the times people do not have a unlimited schedule to just read resumes. So keep it short, keep it succinct, keep it specific. All right, when you get into the interview process of the world, what I like to do is I do it a little bit different than most folks. So you obviously have your general HR one with your benefits and job description, but then I usually break it down. So I actually have a peer group interview so that they can really get a sense of what is the day-to-day like. What is this person? What is their culture that they're bringing? What kind of work environment do they like? And basically, they're trying to analyze you if they can work with you or not. Are you someone that jives with them? From a management perspective, really looking at that leadership team and seeing if you're coachable, if you're moldable, if you're a learner, and really understanding, are there any barriers that we're going to have that just are not going to work? Is there red flags there? And then from an operations perspective, again, our end users, if you're working with one area or one group, I want them bought into the process as well. So I really want to know that you have compassion for them and their business need, and you're making a connection with them. Because in IT and HIM in general, any supporting program you really go into, it's about having that counterpart and really understanding what their business is and the customer service that goes along with it. All right, so example questions that I can kind of give you from my years of experience. Study the basics. Everybody is pretty much going to ask, why are you applying for this job? What interested you in this job? What are your strengths and weaknesses? Uh, what do you want to do in 5 years? Study the basics. I'm sure someone will answer or ask them. Uh, some example questions. I like to throw people off a little bit because I want to see how they actually think through things in the moment. I don't like the generic ones, that's just me. But really, these are some good self reflective questions too. What expectations do you have from the team and management? Because if you interview with someone and their orientation process is a little more hands off, and you go in there and say, "Oh my gosh, I need someone to mentor me and be there with me for, 3 months." That is automatically going to say this is not the right environment for you or for us. So really having those expectations, uh, people are not always good with expectations and guidelines and boundaries, but really understanding what you want out of it, what they want out of it is going to be really key. Another one, what is the greatest compliment that you've ever received professionally or, as a student academically? That's where I really look for what is motivating them, what brings them joy, what makes them smile, what makes them feel proud. And is that something that we can replicate here or that I can use from a recognition standpoint, and really trying to understand people. Um, People love the how do you make a peanut butter and jelly sandwich because it seems so basic and ridiculous. But there are people who will say, I'm going to go get a knife. I'm going to go grab the bread. I'm going to go grab the peanut butter. I'm going to grab the jelly. I like two knives. I don't want to mix my peanut butter and my jelly together because Lord help us. And they are just so detailed to the point of that. And then there's other people who are the complete opposite and they say, yeah, I just go grab it from Quick Trip and the little Uncrustables. So you have a whole gambit and you can really determine what that person's style is. Are they detail oriented? Are they more laid back? Or do they make a funny joke out of it? Just trying to do something a little bit different. One thing to always have when you go into interviews is some type of question or questions that you want answered. Because no matter where you are, what they'll end the interview with is saying, what questions do you have for us? And if you come in and you really don't have any, are you sure? Like you're just willing to go jump right into this? It has some questions. So some that I like and some that have worked in the past are really, go around the table and understand who they are, how long they've worked here, what makes them stay, what is something that they've accomplished lately that they are really proud of. How are you going to be successful in this role? Is it productivity measures? Is it quotas? Is there things you have to do? And is that seem feasible to you? Education in the future and really trying to just understand what this job looks like. Again, the onboarding and mentorship program, if they're a company that wants completely hands off and just like baptism by fire, that's great for people who are okay with that, but a lot of people are not. So knowing that before you get in there and by the second week you are like begging to quit or have quit already, that is just not something you want to set yourself up for. You really want an interview and the first job to be something you can stay with for a bit, and really build you up in your career and your professional development. Something I always like to do is number one, explain to the person that an interview is a two-way street. You have to want the job and you have to be okay with the culture and the team and the core values of the organization just as much as I want you to come on my team, because I don't want someone who will come on and leave within the first few weeks. It's a lot of time, it's a lot of money, it's a lot of preparation. And if it's just not going to work out, it's just not where you want to be. Um, so, what I always ask at the end is, are you still interested in pursuing the position? Because at that point, if they say, Thank you for being really honest with me. It's not what I had thought it was going to be. I'd much rather end that process right there than have them come on board and hate it and really take down the culture and the team morale. So you also have a really important role as coming into a department as an employee or a leader. Those are things you want to consider. Um, and then if you're doing your internships or you have mentors in the area already, ask them for resume reviews or mock interviews. Um, and you can even do them remotely via Zoom or Skype or, a million other ways. But just preparing yourself and hearing different questions and having different styles, they can give you a really good assessment on that. And I wouldn't take the first thing as gold. Some people are one way, some people are another, but really, how are you finding yourself in that process? Uh, Things that I learned being a CSS alum and grad is I actually started the job search early, and they are willing to wait for the right candidate. So if it's a position where they can wait and they will wait, if you're a good candidate, they will. And just don't be discouraged. Something I think they hounded in us was, don't be discouraged if it says registered nurse only. Um, if you want to go in the quality world, you go right ahead into the quality world. If you want to be a patient advocate, you go right ahead and be a patient advocate. Just don't let that requirement deter you. Some things I wish I would have done if I could go back in time, find a mentor in the field right away and just have that person kind of by me, with me through the process, even if it's just I have one question a month, and I just shoot them an email. It would have just been really helpful. Had the internships review my resume or give me some pointers and tips and what kind of interview questions do you ask? Usually people have their list and they'd be more than willing to share with you. Um, Apply for more jobs, and I did not take the information seriously about doing LinkedIn. Again, it was different when I was there, but LinkedIn is really a good tool now and you should use it. Words to live by, just overall, one of the biggest lessons that I've learned over the years is really taking the emotion out of it. And that doesn't mean that you have to be a stoic robot, but it helps you really diagnose what is going on. What is the problem? What's the issue? What are we trying to do? And looking at that would really help you with the rest of the words. It doesn't have to just be a one-way street. You can reinvent yourself. You can really just not worry about what you can't control. Again, COVID's happening. There is nothing any one of us can do about it. What we can do is the things that we have control over. What we can't do is stop the virus at this point as one person. So what we really need to do is focus on what we can control and what we can help with and structure that to really make it meaningful. Additional resources. If you're interested, I have full lists of different interview questions that I like to ask, and it goes through different, like if you're coachable, if you're initiative, what kind of motivation you have. So if you're interested in those, let me know. I'd be more than happy to share. Research different topics that are outside your norm. Go on a TED talk, research, do some learning, find different topics that are kind of out of the norm, because those are things where in an interview you can kind of say, actually, that's interesting. I've looked into perception management or mindfulness or something off the cuff, and this is what I really enjoy about that. I did give an example for if you haven't heard or seen of Simon Sinek. He has a really good golden circle of explaining the why, the what, and the how, and really how to talk to people and get them engaged. Really use these concepts in interviews and have that story to tell. Here is my contact information. So give me a call, send me an email, do a request on LinkedIn. I'd be more than happy to help out with any questions, concerns, issues, anything that you have. I'd be more than happy to help with that. So thanks everybody, and hope you're having fun working from home.